While the coronavirus is having a disastrous impact on cities like New York and New Orleans, the virus is also starting to hit rural America. Take a look at this map showing the growing surge of infections in rural areas. In Wisconsin, there are now more than 2,300 reported cases and 75 dead, including in the state's rural counties. But as we've seen in other places, the actual number may actually be higher. In fact, it's likely higher. Adriana Diaz visited a small Wisconsin town to see how they're preparing for a possible outbreak.
Good morning. While the biggest outbreaks are in cities, out in rural America, many communities have mobilized against the virus. All non-essential businesses are shut in Wisconsin, and that includes small town Wautoma. What we've learned here is that there are unique challenges to fighting the virus in rural communities, but some advantages too.
No place is immune from coronavirus or the fear it carries.
The thing we fear the most is what we don't know and what we can't see.
But out here over cornfields and cattle, at least social distancing comes with the territory. Just ask farmers Adam and Carrie Flight.
I think we naturally self-distance ourselves just being in rural America.
Isolation is easy for us.
It's one of the advantages rural areas have against the virus. Another is a culture of preparedness, says Dr. Javier Rincon, who works in town.
I talked to a lot of people, and we were talking, of course, about the toilet paper. He said, no, I have 96 rolls. I bought them in January. You know, living in the rural community, you learn to be self-sufficient.
Dr. Rincon is one of only 2 doctors at Family Health La Clinica in Wautoma. He says while people are spread out, an already spread thin rural healthcare system could be stretched to the limit.
Mostly because we don't have enough ICU beds. And if our staff actually gets sick, is nowhere we can replace the staff.
If one of your patients tests positive and does need hospitalization, how far do they have to go to get that?
Probably at least an hour.
They have about 70 tests, which they ration, but results take more than a week.
Do you think small healthcare centers like this one in rural areas might not make it to the top of the list?
Yes, we're used to it. If we don't get the results right away, we just treat them as positive until proven otherwise.
Just yesterday, the county confirmed its first case of COVID-19. To keep that number from rising, they guard the clinic like a fort, taking everyone's temperature before granting entry, including mine. Before I could film inside, they also asked that I wear gloves and a mask since I drove up from Chicago, which they consider high risk.
Hello.
Hello.
Hi, Dr. Rincon.
Welcome to the clinic.
Thank you.
So this is our staff in the reception area.
Are people concerned?
Yes, they are. They're very concerned.
The manager at the local supermarket, the Piggly Wiggly, says the virus is top of mind.
For me, I think about it more often because of being with the public. So it does consume me a little more and my children. And so, yeah, I would assume everybody's thinking about it all the time.
This is the main drag of Main Street in Wautoma, Wisconsin, and most stores are shut down. But coronavirus isn't just affecting business in town. This whole area is surrounded by farmland, and farmers have their own concerns.
Less than 10 miles away, they're getting ready for planting season back at Flight Family Farms. Until then, their small staff is making repairs, and with school out, their kids are chipping in too.
We're open 24/7. If we shut down, people don't eat.
Staying afloat depends on their seasonal workers arriving from Mexico for planting season. So they're watching the coronavirus and the calendar closely.
Our goal is to start planting the 8th of April, and we'd like to be done by June 1st. If we miss that window, we don't have another shot at it.
And how would that impact your livelihoods?
It'd be devastating.
It'd be devastating.
For CBS This Morning, Adriana Diaz, Wautoma, Wisconsin.
Yeah, Hank Williams may put it best. A country boy can survive, but we do still need to practice that social distancing.